Question 1. A nurse is caring for a client in the third trimester, presenting with painless vaginal bleeding. What is the nurse's priority action? A. Perform a sterile vaginal exam immediately. B. Place the client on bed rest and notify the provider. C. Administer oxytocin infusion to control bleeding. D. Prepare the client for discharge with education. Answer: B. Place the client on bed rest and notify the provider. Rationale: painless vaginal bleeding in late pregnancy suggests placenta previa. Vaginal exams can worsen bleeding, so the nurse must place the client on bed rest and notify the provider immediately. Question 2. A postpartum client reports sudden shortness of breath and chest pain. What is the nurse's first action? A. Administer morphine as prescribed. B. Notify the rapid response team immediately. C. Encourage deep breathing and coughing. D. Reassure the client that anxiety is common postpartum. Answer: B. Notify the rapid response team immediately. Rationale: sudden chest pain and dyspnea may indicate pulmonary embolism, a life-threatening emergency requiring rapid response activation before symptom management. Question 3. A client in active labor is receiving magnesium sulfate for preeclampsia. Which finding requires immediate intervention? A. Deep tendon reflexes +2. B. Respiratory rate 10 per minute. C. Urine output 45 milliliters per hour. D. Blood pressure 138/86 millimeters of mercury. Answer: B. Respiratory rate 10 per minute. Rationale: magnesium toxicity depresses the respiratory center. A rate below 12 per min is dangerous and requires immediate intervention, typically stopping magnesium and giving calcium gluconate. Question 4. A nurse is caring for a client in labor with variable decelerations on fetal monitoring. What is the best initial nursing action? A. Apply oxygen via face mask. B. Increase IV oxytocin infusion. C. Reposition the client. D. Prepare for emergency C-section. Answer: C. Reposition the client. Rationale: variable decelerations are usually caused by umbilical cord compression. Repositioning relieves pressure on the cord before escalating interventions. Question 5. A postpartum client with cesarean delivery has a temperature of 38.5 degrees Celsius, 101.3 degrees Fahrenheit on day 3. What is the priority nursing assessment? A. Incision site for redness and drainage. B. Breast engorgement. C. Lochia color and odor. D. Pain level at incision site. Answer: A. Incision site for redness and drainage. Rationale: fever on day 3 post-op suggests infection, with the incision being the most likely source. Incision assessment is the priority before other evaluations. Question 6. A nurse is caring for a client in the second stage of labor. Which action is the priority? A. Monitor fetal heart rate every 30 minutes. B. Encourage the client to push with contractions. C. Administer oxytocin for stronger contractions. D. Provide ice chips for comfort. Answer: B. Encourage the client to push with contractions. Rationale: during the second stage, delivery of the baby is imminent, and assisting the client with effective pushing promotes safe birth. Question 7. A nurse is teaching a pregnant client with gestational diabetes about blood sugar control. Which statement indicates a need for further teaching? A. I will check my blood sugar before meals and at bedtime. B. I will avoid snacks between meals to keep sugar stable. C. I will include protein with each meal and snack. D. I will walk for 20 to 30 minutes after meals when possible. Answer: B. I will avoid snacks between meals to keep sugar stable. Rationale: clients with gestational diabetes need balanced snacks to avoid hypoglycemia. Skipping snacks indicates a misunderstanding of dietary management. Question 8. A nurse is caring for a client receiving oxytocin for labor induction. Which assessment finding requires the nurse to stop the infusion immediately? A. Contractions every 5 minutes lasting 60 seconds. B. Uterine tachysystole with late decelerations. C. Blood pressure 122 over 80 millimeters of mercury. D. Fetal heart rate baseline 140 BPM. Answer: B. Uterine tachysystole with late decelerations. Rationale: tachysystole with non-reassuring fetal heart patterns indicates fetal distress. Oxytocin should be stopped immediately to reduce uterine hyperstimulation. Question 9. A nurse is assessing a client with suspected placental abruption. Which symptom is most consistent with this condition? A. Painless bright red bleeding. B. Rigid, board-like abdomen with pain. C. Decreased uterine tone. D. Slow trickle of dark brown blood. Answer: B. Rigid, board-like abdomen with pain. Rationale: abruptio placentae typically presents with painful bleeding, uterine rigidity, and abdominal pain due to concealed hemorrhage. Question 10. A nurse is caring for a newborn immediately after delivery. What is the priority action? A. Administer vitamin K. B. Suction airway as needed. C. Apply identification bands. D. Place baby in skin-to-skin contact. Answer: B. Suction airway as needed. Rationale: airway patency is always the first priority for newborn stabilization before other interventions. Question 11. A nurse is preparing to administer Rho D, immune globulin, to a postpartum client. Which situation requires this intervention? A. Rh-negative mother, Rh-positive infant. B. Rh-positive mother, Rh-negative infant. C. Rh-positive mother, Rh-positive infant. D. Rh-negative mother, Rh-negative infant. Answer: A. Rh-negative mother, Rh-positive infant. Rationale: Rho D. Immune globulin prevents maternal sensitization when the mother is Rh-negative and the newborn is Rh-positive. Question 12. A nurse is delegating postpartum care tasks to an unlicensed assistive personnel, UAP. Which task is appropriate to delegate? A. Assessing the fundus. B. Monitoring lochia amount. C. Assisting client to ambulate. D. Evaluating perineal healing. Answer: C. Assisting client to ambulate. Rationale: ambulation assistance is within UAP scope. Assessment tasks such as fundus, lochia, or wound evaluation require an RN. Question 13. A nurse is assessing a client with suspected ectopic pregnancy. Which finding is most concerning? A. Unilateral lower abdominal pain. B. Vaginal spotting. C. Referred shoulder pain. D. Nausea and fatigue. Answer: C. Referred shoulder pain. Rationale: referred shoulder pain indicates internal bleeding from ectopic rupture, requiring immediate intervention. Question 14. A client in labor suddenly complains of chest pain and shortness of breath. Which complication should the nurse suspect first? A. Amniotic fluid embolism. B. Placenta previa. C. Uterine rupture. D. Pulmonary infection. Answer: A. Amniotic fluid embolism. Rationale: sudden chest pain, dyspnea, and collapse in labor strongly suggest amniotic fluid embolism, a medical emergency. Question 15. A nurse is monitoring a postpartum client with a firm fundus but excessive bright red vaginal bleeding. What is the most likely cause? A. Uterine atony. B. Vaginal laceration. C. Retained placental fragments. D. Endometritis. Answer: B. Vaginal laceration. Rationale: a firm uterus rules out atony. Bright red bleeding with firm tone suggests trauma, such as a vaginal laceration. Question 16. A nurse is providing care for a client with hyperemesis gravidarum. Which finding indicates the need for immediate intervention? A. Weight loss of 2 pounds in 1 week. B. Urine ketones present. C. Nausea in the morning. D. Mild electrolyte imbalance. Answer: B. Urine ketones present. Rationale: ketones indicate starvation and dehydration, requiring immediate IV fluid and electrolyte replacement. Question 17. A nurse is providing discharge teaching to a postpartum client prescribed iron supplements. Which statement indicates correct understanding? A. I will take the iron with milk to reduce stomach upset. B. I should avoid taking vitamin C with iron. C. I will take iron on an empty stomach with orange juice. D. I should stop iron once I feel stronger. Answer: C. I will take iron on an empty stomach with orange juice. Rationale: vitamin C enhances iron absorption. Taking iron with dairy reduces absorption. Therapy must continue as prescribed, not based on symptoms. Question 18. A laboring client is receiving an epidural for pain relief. Which finding requires immediate action by the nurse? A. Blood pressure 82/50 millimeters of mercury. B. Pain score 4 out of 10. C. Mild itching. D. Fetal heart rate 140 BPM. Answer: A. Blood pressure 82/50 millimeters of mercury. Rationale: hypotension is the most dangerous complication of epidural anesthesia, threatening uteroplacental perfusion. Question 19. A nurse is assessing a postpartum client with suspected endometritis. Which finding supports this diagnosis? A. Uterus firm, midline. B. Lochia with foul odor. C. Decreased WBC count. D. Afebrile vital signs. Answer: B. Lochia with foul odor. Rationale: endometritis typically presents with fever, uterine tenderness, and foul-smelling lochia. Question 20. A nurse is preparing a client for induction of labor with oxytocin. Which condition would make this procedure contraindicated? A. Gestational diabetes. B. Placenta previa. C. Postterm pregnancy. D. Oligohydramnios. Answer: B. Placenta previa. Rationale: placenta previa contraindicates vaginal delivery, and induction could cause catastrophic hemorrhage. C-section is required. Question 21. A postpartum client has heavy vaginal bleeding with a boggy fundus that does not respond to massage. What is the nurse's next priority intervention? A. Increase the IV oxytocin fusion. B. Notify the rapid response team. C. Insert a second large bore IV line. D. Apply bimanual uterine compression. Answer: A. Increase the IV oxytocin fusion. Rationale: if massage is ineffective, pharmacologic intervention with oxytocin is prioritized to stimulate contraction. Preparing IV access and notifying providers follows, but does not precede the immediate need to stop hemorrhage. Question 22. During postpartum discharge teaching, which client statement requires urgent clarification to prevent complications? A. I should avoid heavy lifting until cleared at my checkup. B. I'll call if I notice a sudden increase in vaginal bleeding. C. I can use tampons when my bleeding gets lighter. D. I'll continue taking iron if I feel weak or dizzy. Answer: C. I can use tampons when my bleeding gets lighter. Rationale. Tampon use increases the risk of infection during the vulnerable postpartum period. This requires urgent correction. Question 23. A client in active labor with a history of 2 cesarean sections develops sudden abdominal pain, loss of fetal station, and late decelerations. Which is the nurse's first action? A. Call for an immediate cesarean birth. B. Apply oxygen at 10 L via non-rebreather mask. C. Initiate a rapid IV fluid bolus. D. Reposition the client to the left lateral side. Answer. A. Call for an immediate cesarean birth. Rationale. Classic signs of uterine rupture require immediate surgical intervention. Supportive actions are secondary to surgical preparation. Question 24. A client with preeclampsia has platelets of 65,000 per cubic millimeter, BP 160 over 110, and complains of epigastric pain. What is the nurse's priority action? A. Prepare for magnesium sulfate infusion. B. Notify the provider about HELLP syndrome suspicion. C. Prepare emergency equipment for potential seizure. D. Assess fetal heart tones immediately. Answer. B. Notify the provider about HELLP syndrome suspicion. Rationale. The findings suggest HELLP syndrome, which requires urgent multidisciplinary intervention. Seizure precautions are important but secondary. Question 25. A newborn of a gestational diabetic mother is jittery with a glucose of 28 milligrams per deciliter. What is the nurse's immediate action? A. Notify the neonatal provider. B. Initiate IV dextrose as prescribed. C. Feed the newborn breast milk or formula. D. Place the newborn under a warmer. Answer. B. Initiate IV dextrose as prescribed. Rationale. A glucose of 28 milligrams per deciliter is critically low. Oral feeding may not be effective quickly enough. IV dextrose is required. Question 26. A postpartum client is receiving misoprostol rectally for hemorrhage. Which assessment finding indicates the drug is effective? A. Decreased vaginal bleeding with firm fundus. B. Uterine tenderness reduced after 30 minutes. C. Blood pressure increased to baseline. D. Absence of large clots in lochia. Answer. A. Decreased vaginal bleeding with firm fundus. Rationale. Misoprostol's goal is to stimulate uterine contraction and reduce hemorrhage. A firm fundus and reduced bleeding confirm effectiveness. Question 27. A client's umbilical cord prolapse is confirmed. After placing the client in knee-chest position, what is the nurse's immediate next action? A. Apply warm sterile saline soaked gauze to the cord. B. Administer oxygen by non-rebreather mask. C. Use a gloved hand to elevate the presenting fetal part. D. Call for immediate cesarean birth. Answer. C. Use a gloved hand to elevate the presenting fetal part. Rationale. Manual elevation prevents cord compression until delivery. Positioning is first, but maintaining circulation is next priority before surgery. Question 28. A client at 32 weeks presents with headache, blurred vision, and RUQ pain. Labs show AST220 and ALT190. What complication is suspected? A. Worsening preeclampsia with hepatic involvement. B. Placental abruption. C. cholecystitis. D. Severe hyperemesis gravidarum. Answer. A. Worsening preeclampsia with hepatic involvement. Rationale. Elevated liver enzymes with RUQ pain indicate liver damage from preeclampsia, consistent with progression toward HELLP syndrome. Question 29. 2 hours after delivery, A client has a firm fundus at the umbilicus, but saturates a pad every 20 minutes. What should the nurse suspect? A. Cervical laceration. B. Uterine atony. C. Perineal hematoma. D. Endometritis. Answer: A. Cervical laceration. Rationale: heavy bleeding despite a firm fundus suggests a laceration, not atony. Surgical repair is usually required. Question 30. A newborn delivered by cesarean is grunting, retracting, and cyanotic. Which intervention takes priority? A. Place the infant in skin-to-skin contact. B. Initiate continuous positive airway pressure, CPAP. C. Administer blow-by oxygen. D. Stimulate the infant with suction and drying. Answer: B. Initiate continuous positive airway pressure, CPAP. Rationale: signs indicate respiratory distress syndrome. CPAP provides immediate lung expansion, support more effectively than oxygen alone. Question 31. A pregnant client with placenta previa presents to triage with vaginal bleeding. Which order should the nurse question? A. Insert a large bore IV catheter. B. Perform a transabdominal ultrasound. C. Apply continuous fetal monitoring. D. Perform a digital cervical exam. Answer: D. Perform a digital cervical exam. Rationale: vaginal exams can provoke life-threatening hemorrhage in placenta previa and must be avoided. Question 32. A client receiving an epidural develops BP 82/50 and FHR decelerations. What is the nurse's first action? A. Administer an IV fluid bolus. B. Place the client in Trendelenburg position. C. Call the anesthesia provider immediately. D. Apply oxygen at 10 liters per minute. Answer: A. Administer an IV fluid bolus. Rationale: hypotension reduces placental perfusion. Fluid bolus restores circulating volume quickly before other supportive actions. Question 33. Before starting oxytocin, the nurse notes contractions every 2 minutes, lasting 90 seconds. What is the appropriate action? A. Begin infusion at the lowest rate. B. Hold infusion and notify provider. C. Administer tocolytics before oxytocin. D. Document findings and proceed. Answer: B. Hold infusion and notify provider. Rationale: contractions this frequent indicate uterine tachysystole, making oxytocin unsafe. Infusion must not be initiated. Question 34. A client on magnesium sulfate for preeclampsia has RR10 per minute, absent reflexes, and urine output of 20 milliliters per hour. What is the nurse's immediate intervention? A. Continue monitoring closely. B. Stop magnesium and give calcium gluconate. C. Notify the healthcare provider. D. Increase IV fluids for kidney clearance. Answer: B. Stop magnesium and give calcium gluconate. Rationale: findings indicate magnesium toxicity. Antidote: calcium gluconate is administered immediately to prevent respiratory arrest. Question 35. A postpartum client reports severe rectal pressure, unrelieved by pain meds. Uterus is firm and lochia minimal. What should the nurse do first? A. Apply ice packs to perineum. B. Assess perineum for hematoma. C. Notify the provider immediately. D. Administer stronger analgesics. Answer: B. Assess perineum for hematoma. Rationale: severe pain and minimal bleeding with a firm fundus indicate concealed bleeding, often a hematoma. Assessment is first. Question 36. A 28-week client in preterm labor is receiving betamethasone. Which assessment finding confirms effectiveness? A. Maternal blood pressure stabilizes. B. Fetal movement becomes regular. C. Neonate's respiratory status improves after birth. D. Uterine contractions decrease in frequency. Answer: C. Neonate's respiratory status improves after birth. Rationale: beta-methysone enhances fetal surfactant production, reducing respiratory distress after preterm delivery. Question 37. A newborn of an opioid-dependent mother is inconsolable, has tremors, and exhibits hypertonia. What is the priority nursing intervention? A. Swaddle tightly in a quiet environment. B. Administer prescribed morphine. C. Place under a radiant warmer. D. Encourage frequent breastfeeding. Answer: A. Swaddle tightly in a quiet environment. Rationale: comfort measures, low-stimulus environment swaddling, are first line to minimize withdrawal symptoms before medication is considered. Question 38. A Rh-negative mother delivered an Rh-positive infant. Which test must be reviewed before administering Rho D, immune globulin? A. Indirect Coombs test. B. Maternal platelet count. C. Direct Coombs test on the newborn. D. Maternal hematocrit level. Answer: A. Indirect Coombs test. Rationale: indirect Coombs test determines if the mother is already sensitized. Rho D is given only if the result is negative. Question 39. A client with gestational hypertension reports persistent headache and blurred vision. Which action is priority? A. Obtain reflex assessment. B. Collect urine for protein analysis. C. Administer antihypertensive as ordered. D. Place seizure precautions. Answer: D. Place seizure precautions. Rationale: neurologic symptoms signal progression toward eclampsia. Preventing maternal or fetal harm from seizure is top priority. Question 40. A postpartum client has HR 124, BP 88/60, pallor, and dizziness. Fundus is firm at midline, lochia minimal. What should the nurse suspect? A. Uterine rupture. B. Concealed hematoma. C. Retained placenta. D. Endometritis. Answer: B. Concealed hematoma. Rationale: tachycardia, hypotension, pallor, and minimal bleeding despite firm fundus point to internal bleeding from a concealed hematoma.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.